This presentation is going to cover pediatric shock and more specifically pediatric burns. With that primary assessment of the patient, big things to consider is those little kids are extremely susceptible to hypothermia on a regular basis, let alone whenever you take away their blanket layers of skin. So that skin is a protective layer, keeps them warm, and it also keeps them protected from infection. So they're very susceptible to widely systemic infections. And with that, as your skin and all the pathways and nerves in there are to maintain your fluid balances, they're very susceptible to hypovolemic shock. So we need to prevent further fluid loss and to replace those fluids. As a review of the burn classifications, there is superficial, formerly known as a first-degree burn, partial thickness, formerly known as the second-degree burn, and the full thickness, yes, you guessed it, formerly known as a third-degree burn. So no superficial burns, that's your typical, what looks like a sunburn, just that epidermis, that outer layer of skin is red and sore. And the partial thickness, it's getting down into multiple layers of skin, so it's going to start to bubble and blister. So if you see blisters, that's your sign of a second-degree burn. And the full thickness, that's down all the way to the muscle, going through all the layers of skin and burning through the nerves. So that actual full thickness burn won't hurt. What's painful is the partial thickness and superficial burns. And some text and other readings, you might see things of a 4th degree or even 5th degree burns, and that is burns involving complete muscle tissue, and 5th degree going through and burning all the way through the bones. And typically those are not survivable burns. I believe everybody's familiar with the rules of nines as it pertains to calculating burn surface area. And with kids, it's pretty close, but it changes up a little bit. So with those kids, the whole head is 18%. Since it's a great big old bobblehead, or adults, the whole head is 9%, and kids is 18% because it's much larger proportionally than the rest of the body. So whole head 18%. Each arm is 9%. The front torso 18%. The back torso 18%. So the whole torso is 36%. And each leg is 14%. So 7% on the front anterior side, 7% on the posterior side. And so the primary treatment of those patients is going to be preventing that hypothermia, keep them warm, cover them up with clean, sterile dressings over those wounds, and cover those wounds up with blankets. Keep them clean. So rinse those wounds out with clean, sterile water. You know, your saline bags or that sterile, fancy medical grade water that we're carrying on the ambulance, and prevent the fluid loss and replace those fluids. When replacing fluids, the fluid that is preferred is lactated ringers, but sodium chloride works just as well because most of our resuscitation is only during a quick intervention. And then some places worry about lactated ringers and potentially causing hyperkalemia, so they definitely want to get a good lab value before they're getting fluid overloaded. So in our field, we're stabilizing with normal saline. So we're going to use that Parkland formula for fluid resuscitation, and that is 4 milliliters times the burn surface area times their weight in kilograms. Now when calculating that burn surface area for fluid replacement, you're only going to calculate that partial thickness and full thickness involved. So whatever area has blisters or worse is what you calculate. For first degree, the superficial burns, we're not calculating that into the burn surface area. Now if you tell the receiving hospital the total burn surface area is one thing, but when it comes to fluid replacement, we're only worrying about the heavily involved tissues. And then half of that is calculated is going to be given over those first 8 hours. So when you're calculating up that fluid replacement, it's going to be your total volume that needs done and that's for a 24-hour period. So take half of that and calculate that as a drip over 8 hours. So it's still going to be quite a bit of fluid. So let's do an example here. So we're going to do our 4 milliliters times our patient who had 20% burns of second degree or greater times their weight of 30 kilos. When you do that math, that comes out to 2,400 milliliters the patient's going to need over 24 hours. And you need to figure out how much of that they're going to need the first 8 hours by dividing by half. So we're going to need 1,200 milliliters over 8 hours. And to start figuring out for our drip weight, we got to get that figured out to a single hour. So that's going to be 150 milliliters per hour that patient's going to need. And that's just by dividing 1,200 by 8. So to get that figured out into our drip factor, we need to start converting some units here. So multiply it by 1 hour equals 60 minutes. So we can cross out our hours. And then we need to get it into figuring out drops per minute. So we need to multiply it by our drip factor. 10 drops equals 1 ml. And we'll cross out those mLs, and we're left with drops per minute. So then we solve, that comes out to 25 drops per minute. Now for a little practice. Let's take this scenario that you've got a pediatric patient who sustained the depicted burns in this picture. So the redness on his legs, those are all partial thickness burns on this kid. And the patient weighs 15 kilograms. So you need to calculate that burn surface area and figuring out the patient weighs 15 kilos. Okay, so let's solve this out. So we're going to do with our 4 milliliters times and burn surface area. What you come up with? Okay, so let's do this. Half of the front leg, so the anterior part of each leg, 7%. So half that, 3.5, plus 3.5 from the back side, 7, plus 7 is 14. Okay, so we got 14% affected times this patient's weight, and we have what? 15 kilos. Okay, so now doing the math, that's going to come out to 840 milliliters over 24 hours. Okay, but half of that's got to be given in the first 8 hours. So we're going to do 420 milliliters over 8 hours, which comes out to 52.5 milliliters an hour, but we're going to do 53 milliliters per hour. And then solving this out again the same way, 1 hour over 60 minutes. So now we can cross out those units times our 10 drop set, 1 milliliter, cross out the milliliters, and we're left with drops per minute. So doing out the math, 8 drops per minute. Easy enough, right? Alright, so let's do this same equation in the same scenario, but let's say that the family, for whatever reason, waited 2 hours to call. They tried to self-treat or whatever they did. So the equation is still going to start out essentially the same. That 4 milliliters times that 14% times that 15 kilo body weight. Okay, we do out the math, that's initially coming out the same. 840 milliliters over a 24-hour period. But we know that half of that has to be given in that first 8 hours. Okay, so that's 8 hours from the onset of the burn. So since we're already 2 hours in and they've got no fluid, essentially our drip's got to be 420 milliliters for 6 hours since we're 2 hours in. Okay, so now that changes up our milliliters per hour a little bit. So now we're at 70 milliliters per 1 hour. And still doing our math, 1 hour equals 60 minutes. Cancel out our hours units times our drip factor, 10 drops, 1 ml. So cancel those out, and once we do that math, that's going to come out to roughly about 12 drops per minute. So in our previous answer was 8 drops a minute. Now a little bit more fluid in there. Now let's talk about shortcuts. Everybody in EMS likes shortcuts, especially when it comes to math. So this shortcut only applies if that burn is less than 8 hours old. So we're going to calculate how much fluid that patient needs within that first 8 hours. So the shortcut is you still take the burn surface area and you multiply that by their weight in pounds. So not kilos, just in pounds. And you divide that by however many hours are remaining in that first 8 hours. So like for example, in our previous scenario, the patient had 14% burns and they were 15 kilos. So if you multiply that by 2 times 2, that's 33 pounds. So say if it came up to you and said, my baby's 33 pounds. And you know that, and they got burnt 2 hours ago, so you'd have 6 hours left in that window. So when you do the math, that's 462 divided by 6. That comes out to 77 milliliters per hour. So in that previous scenario, when we actually did the full out math of everything, that came out to 70 milliliters per hour when you did a true math. So just that quick, dirty way to get everything started for that first 8 hours. Burn surface area times their weight in pounds divided by hours remaining in the first 8 hour window. So as a review, these pediatric patients are extremely susceptible to hypothermia. So you need to keep them warm, cover up those wounds with a clean, sterile dressing, and then layer them in blankets. They're susceptible to infection, so making sure those dressings are clean, sterile, clean the wounds with sterile water, cover them up, and they're susceptible to that hypovolemic shock. So prevent any further fluid loss by bandaging and dressing, and making sure they maintain their heat balances, and then appropriately replace fluids.